Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about what you can do when baby has a cold. The common cold can be caused by one of many viruses. It usually lasts a few days to a week, but occasionally lasts longer. If symptoms last longer, it could be a sinus infection or maybe allergies. It can be difficult to tell the difference between a cold and a sinus infection or an allergy, such as hay fever. Contact baby's doctor if symptoms hang on and baby doesn't feel better. Colds are usually transmitted by touch, not by someone coughing or sneezing on baby. Baby can get as many as 6 colds a year due to an immature immune system. Babies are nose breathers and don't breathe through their mouths. Over-the-counter saline nose drops can be used to thin nasal secretions, making it easier for you to suction mucus. Drain her nose with a bulb syringe as needed, especially before eating. If she can't breathe well, she can't eat well. When baby has a cold, give her plenty of fluid to drink. It may be difficult for baby to nurse or bottle feed when she's congested, so encourage frequent feedings. Use a cool mist humidifier to keep air moist. Run the humidifier in the room where baby spends most of her time, or turn on the shower to create steam in the bathroom. Steam can help loosen mucus. Put a few drops of eucalyptus oil on a washcloth and put it in the shower. Vapors in the steam may help baby's breathing. Babies younger than 6 months of age are rarely given over-the-counter medications, with the exception of child-strength acetaminophen or ibuprofen. But don't use anything unless your doctor tells you to do so. Ask before you give them. If you're advised to use them, follow package instructions very carefully. Infants under 2 months of age should not be given any medication unless specifically ordered by your pediatrician. Don't give baby echinacea. It's not okay for a child. It's ineffective and could lead to a rash in your child. Also avoid all cough and cold medicines. They're too powerful for baby. If baby doesn't seem too troubled by her cold, wait to give her medication. If she's miserable, coughing, and or congested, use an over-the-counter child's medication as instructed by your doctor. Breastfeeding helps prevent colds and flu in babies under 1 year of age, so keep breastfeeding. Wash your hands frequently and have others wash their hands before touching or holding baby. Don't take baby out in crowded places where she might be exposed to people with colds. Ask your doctor about a flu shot for baby. Call your baby's doctor if baby has difficulty breathing or is breathing rapidly, flares her nostril with each breath, wheezes, has bad color such as pale, ashen, gray, or bluish tinted skin, isn't eating well, cries uncontrollably, is listless, has a fever above 101 degree Fahrenheit that lasts for 2 days or longer, tugs on her ears, or is not having wet diapers. If baby has some of the above symptoms, your pediatrician may want to see her to rule out anything more serious. Babies may be treated with antibiotics if a secondary infection has developed, such as an ear infection. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.